Good afternoon, everyone. It is a little bit after 3 o'clock, so we will start our webinar. So I'm Jackie Rouse, and I'm Vice President for Community Health for Advocate Aurora Health. I am being joined today by Kimberly Hobson, the Southside Healthy Community Organization CEO, who will provide with us opening remarks. And then I will be reviewing the RFP with Leif Elsmo, our Executive Director for Community and External Affairs at University of Chicago Medicine. Then we will take your questions, and we will provide answers to any of the questions that you might have, which you can submit through our question and answer portal. And without any further ado, I will introduce Kimberly Hobson, who will be giving us some information about the organization.
Well, thank you so much, Jackie. Good afternoon. I almost said good morning. The day has gone so fast, but good afternoon, everyone. As Jackie mentioned, my name is Kimberly Hobson, and I am the CEO of the Southside Healthy Community Organization, which we fondly call the SSHCO. So if you hear us say SSHCO, we mean our organization. And so although I'm new, about 5 months in as the CEO of the Southside Healthy Community Organization, I have a 30-year career of working in organizations on or that supported the South Side of Chicago. So this work is, I'm very passionate about it, and it is certainly near and dear to my heart. So I'll jump right over to the Southside Healthy Community Organization and let you know, no, go back one slide and let you know who we are. The Southside Healthy Community Organization is comprised of about 13 healthcare organizations. We have 6 federally qualified health centers. We have 5 safety net hospitals, and we also have 2 health systems that are a part of this organization. If you can look at the slide and see the picture to your right, we span the entire South Side of Chicago. We're kind of sprinkled throughout the entire South Side of Chicago, and we serve about 15 communities and zip codes. 15 zip codes, I should say, on the South Side of Chicago. So these 13 organizations are spread across the South Side, covering these 15 zip codes and working together to improve health of residents on the South Side of Chicago. So can you go to the next slide? As I mentioned, we have our 13 organizations, and we began our work, as many of you know, in a couple of years ago, but we have been in full force working in this organization for throughout this entire year. And our goal is to really, build a model. We actually built a healthy community model, and that model is being executed on right now, and it will be executed on over the next 4 years after this year. And what we aim to do is, overall, we aim to, with the community's input, which has been critically important to us from the very beginning, to improve access, to address social determinants of health. And we also want to overall improve outcomes of residents on the South Side of Chicago. And so our healthy community model on the right hand side of this slide, we have a few components of that model. And the first one is to improve access, and that's where we're going to be adding primary care providers on the South Side of Chicago, specialty care, maternal health, behavioral health providers, and they will be deployed into the community that you saw earlier to help us get this work done. We will also, once all of these providers are out into the community over a period of time, we will also be creating something that is very, very exciting. It's not been done before, but we certainly believe that we can do this. And we will have a connected care technology platform across all 13 of our sites, which will allow us to better serve our patients, because we will be able to see what's happening with their health care, no matter where they end up getting the health care on the South Side of Chicago. We will also be deploying a team of community health workers and nurse care coordinators to help patients as they navigate this very complex, sometimes, healthcare system. And then we'll be partnering with a variety of organizations to increase access to community resources. You can go on to the next slide. But I think it's also a huge part of what we're doing. We know that healthcare proper is not, it is a small portion. I should say about 40% of the health, the overall well-being of individuals. The social determinants of health are about 60% or so of the well-being of individuals. And so that's why we're here today, because we have a goal of partnering with community-based organizations like yourself that will help us to execute on this healthy community model that we talked about. And so this RFP is actually going to give the SSHCO the opportunity to partner with our CBOs, as we call them, who are already working and doing lots of good work in the community. Everything does not have to be created by us, but we certainly want to provide options, provide resources across the South Side, and we want to partner with those who are doing that work already. So we're actually looking to resource existing organizations and new program concepts and so forth, with grants up to $125,000 that can help address some of these social determinant needs of our community and our population, and support the goals of the Southside Healthy Community Organization. And so I know that Jackie and Leif will continue forward. They will give you more details about this opportunity for grant and for funding and for partnering with the Southside Healthy Community Organization. And so I'll stop there and I'll toss it right over to, I believe, back to Jackie.
I think I pick it up from here.
All right.
You, Kimberly.
Okay.
Appreciate it. I'm going to go through this timeline in a second, but I'd like to just pause for 1 second. Thank you, Kimberly, for the overview, and say, just do a little flash forward, a foreshadow here that, as you saw on the agenda, we're going to have some time for question and answer, and I will repeat this in a bit, but wanted to let you know now that the function that we're going to use today to answer questions throughout the webinar is, if you look on the bottom of your Zoom window, there is a Q&A button. We're going to use that to direct questions to both Jackie and myself throughout the rest of the webinar. So I'm giving you a cue forward here that if you have a question, you can drop it in there. We're actually using that functionality over the chat so we can get to as many questions as we can here today. And we'll also at the end give an outlet where if you have questions after this webinar, you certainly can submit through email. But you'll see that email on the bottom of this slide. This slide serves as, let's call it your Google Maps, right? Your GPS on the journey here for applying. We have, obviously, all of you, there's quite a few folks in the room today, have heard something about this at this point, or you wouldn't be at this webinar. So we're at this point today, October 19th, in the RFP webinar. This was released a little over a week ago, and we're moving toward a deadline here of October 24th for letters of intent. You'll see below here the important dates that's a 5 p.m. cutoff Central Standard Time for that LOI, and that letter of intent would actually be submitted online. You know, you don't have to send a separate letter for this. We have a link inside the RFP. I'm sure we will circle back on this again here during this webinar, but wanted to let you know that that link to the LOI is there. We've tried to make that as easy as possible. You'll see the next deadline. You do not have to have attended today to submit an LOI, just so you know, for if you're sharing with other collaborating organizations, but we will require an LOI where we will confirm that and move to a full proposal. That proposal will be due on November 10th, Thursday, November 10th, also a 5 p.m. cutoff Central Standard Time. That application will actually be emailed to the address that is here, info@southsidehealthycommunity.org. That's where you'll submit your proposals ultimately, but please submit the LOI first by 5 p.m. on October 24th. With that, we have some other items we want to cover with you here today. I will say and note that after we go through the review process, ultimately here, the SSHCO board will weigh in on final decisions, and that notification should be in December of this year. So it's moving pretty fast. We're excited about that because we really do want to get to the work of building this ecosystem here to help support patients. With that, we're going to cover a few things here: RFP overview, some eligibility criteria, et cetera. Jackie, I'll hand to you for the next slide.
Thank you, Leif. So the overview, the SSHCO is really looking at proposals from community-based organizations. And they can be existing programs or new program concepts that really focus in on several of the social determinants of health. And so employment is one area, emergency financial support is another area, and that could include utilities or household expenses. Those are, then we also have housing and food insecurity. So your program really needs to focus on one or more of the above listed determinants. It's also preferred that your organization is located within the south side of Chicago, but that is not actually just a requirement. So it is, the work that we do for the SSHCO is focused on those 16 zip codes that Kimberly had pointed out to us. So we just want to make sure that those services are being provided to those community areas. Those community areas and zip codes are pointed out here in the RFP as well. And so there's a number of those zip codes are listed there. And you can find that also in the RFP. And we only one applicant per organization will be accepted for this round of applications. And so just want to make sure that you understand that. And then the range of awards, we do encourage organizations of all sizes and experiences to apply for the grants, and that's up to $125,000. And so that is, we're not trying to limit it to large organizations or any type of organization, but those do need to be all the different sizes. And then the project period is 1 year, and with a potential to renew based on performance. And that's it. I will hand this back over to Leif for the next section of the RFP overview.
Thank you so much, Jackie. To cover a little bit more about what we're expecting here in eligibility criteria, we are looking for organizations or coalitions that are seeking funding for proven promising practices. We did talk about some new program opportunities here, but built upon some foundation of a promising practice would be a good idea, backed by evaluation where possible. And in the social determinant areas, as Jackie has pointed out, around employment, emergency financial support, housing, and food insecurity. To be eligible here, we are looking for 501c3 nonprofit organizations, or we will consider fiscal agency, but we will need a 501c3 to receive the grant. And in the zip codes that are aligned here with the Southside Healthy Community Organization zip codes that Kimberly outlined, Jackie has outlined before, it's important that these services that are provided in these zip codes, even if your organization is not housed in these zip codes, the services will be provided here. Applicants must be open to all services to all backgrounds, race, religion, sex, age, disability, national origin, or sexual orientation. Very important here. This is a health equity grant. We want to be inclusive across all services. All proposals will need to measure. We are looking for tracking and measurement here on these grants. Most of you are familiar with that through other channels that you've done your work. So we are looking for that tracking and measurement that is related to, where possible, smart metrics that are specific, measurable, attainable, realistic, and time bound. I'm pretty sure most of the organizations here that I see on today have had experience with that. Projects that involve collaboration is encouraged. This whole initiative is a collaboration, and we're really looking at building around, wrapping around the services that we're talking about here in this transformation project. So with that, we have a few more things to cover, both in terms of the product descriptions and exclusions. So Jackie, if you can pick it up from here.
Thank you. So really, the RFP is really designed for you to help describe your program. So your answers will be scored. And so we do expect a project description that has the goals and the objectives, what different stages of the project will be developed and how you will implement that project. And then recognition of the external factors or trends that might affect your program. So we'll be looking at those components for the project description. As far as organizational experience, we'll be looking to see how you're working with under-resourced populations or the vulnerable populations. You know, the SSHCO program is really working within all our populations within the South Side. So we want to hear more about that. Experience really implementing programs geared towards addressing social determinants of health. And so those social determinants of health that are those 4 key focus areas that we talked about earlier. And then also, what is the experience of the organizations to partner with the Southside community and really within our target area, who are your collaborative partners? Then, of course, you know, with every RFP, we want a budget. And we're asking for 1 page maximum on that. And the budget should show each item and its costs. Also, we want a justification for each item that is in your budget, and then how your project or program is going to be sustainable. And then the last component would be our evaluation plan. And then really the objectives that are in alignment with required outcomes, and any additional outcomes that you anticipate that your program is going to deliver. And then also discuss activities, indicators, the targets that you are hoping to achieve, and then the time frame for completing each of the programs in each of the sections of your program. Those are really the description of the different components of the RFP that we expect. And I think, Leif, you can cover exclusions on the next slide.
Yeah, thanks, Jackie. It's in the what it's not section, negative poll. We covered most of what we're looking for here, but just to put some clarifying points on this, that we're excluding proposals or thoughts from partisan political organizations. For-profits for this particular RFP are excluded. This is not a grant for fundraising activities or sponsorships, advertising, or tickets. This is purely around programming here. No applications will be considered from individuals or from endowments or memorials, you can see. There's no expressed or implied obligation that SSHCO reimburse responding organizations for any expense incurred while pulling the proposal together. So want that to be clear. And we're not really doing cost sharing or matching funds. They're not required here for this. This is a grant directly for programs to work on impact around building the model here. So that we do care, obviously, you know, as you're putting forward budgets here, you know, as you want to paint the picture of other sources that you have to sustain this work, that's great, but we're not requiring a match for this particular grant. Those are the exclusions at this time. I have seen activity here in the question answer window. What I will say is that Jackie and I are going to remain on screen here. Reminder that You can still submit questions using the button at the bottom of your Zoom window. If you mouse over that, you'll see a Q&A. If you open that window on that button, you'll be able to submit your questions. And we have a couple live here now, and I can take the first one, Jackie, and then we can alternate here or figure out where we need to be as we move through. The first question was around, wow, the LOI is due on Monday. That's a quick turnaround. It doesn't leave much time. We tried to make that as easy as possible for the LOI section.
Mhm.
So there is actually an online form for this that you can fill out. It's embed in the RFP itself, and we do need that submitted by the 24th. We recognize that is a quick turnaround. However, we've made it as efficient as possible for you. We're trying to have a sense of what bucket or what area what focus area the organizations might have around this, and then there will be an additional couple weeks here for the proposal, which we understand will take more time and need more rigor. So the LOI, we've tried to make it as efficient as possible. We understand it's a quick turnaround, but we think we can that most folks can do that at this point. It's really raising your hand for what you think the focus of your proposal will be. You want to take the next question here, Jackie, and then I'll look forward. We'll kind of leap ahead, so we're handling as many as we can.
Sure. So our next question is, do you have to provide services to individuals in all the zip codes listed or a certain number? And so there's no restriction. We don't expect you to provide services in all the zip codes. It's whatever your service area is and what zip codes you want to provide. And so it's really based on the scope of your program.
Thanks, Jackie. My mic's still on here, right? You can hear me?
Mhm.
Great. I'm looking for that confirmation. The next question is around, does the organization have to directly provide one of the 4 determinants that we've listed in the RFP, or can they provide wraparound services? It's a great question. I think that we have listed these because we know that we have heard through listening sessions, town halls, a number of different alignment with broader state initiatives, our own goals, that we know these are needed at some level. It would be great if groups had one of them in that pool of wraparound services, but I think it's okay here to have a proposal for wraparound services. I would recommend that in that wraparound model, that some of these things are included. We know there's a need for our patients population here, and would like to have at least identified one of those as a priority, but wraparound services is absolutely acceptable here as long as it's supporting patients and health improvement and outcomes. So appreciate that. Next question, Jackie.
So the next question is, so many organizations don't need the entire 125,000, so we can apply for smaller amounts. That's great. Is there a minimum? If we have a program for 25,000, is that okay and acceptable? And I would say yes. Keep in mind the scope of your program and the reach. And so if that is something that makes sense to do for 25,000, then you can always apply for some funding.
Thanks for that, Jackie. Question on budget here. What are the allowable costs and costs not allowed in the budget? There's a parenthetical statement here that is, can money go towards funding staff or hiring staff? The answer is yes to that question. We understand that this is a people intensive workflow here, and we understand that. So yes, it can be used for staff, fringe, as well as program expenses. I wouldn't say we received some questions. I'll do an add-on on this, Jackie, just because we received some stuff by email around, can we make some capital expenditures here? I think within reason, if it's to help support the program and program delivery, we'd consider it. We're not looking at funding buildings or capital projects like that, but there may be some capital expenditures in there that support the program. And by that, I mean, that might be in people's capital budgets, a technology or something like that, that helps the delivery of the program or efficacy of the program. So we're open to seeing that here. This is our first issue of this grant here for the SSHCO. So we'd be open to looking at that, but staff can definitely be included here in this round of proposals. Next question.
Okay, is a uniform grant budget required, or do we have the freedom to make our own? So I believe in the RFP, there was a Excel budget form, and we would ask that you use that as part of your application.
Yeah, I'll add a block on top of that to Jackie that, we mentioned before in a previous answer around if you have other funding sources or those kinds of things. I think that's useful to include that you have some of those in your narrative at some point here through the narrative portion. So appreciate that. Next question was also about the grant itself, funds flow, those kinds of things. Is this a reimbursement grant, or will funds be awarded to carry out the grant's mission? If reimbursement, may you request an advance for startup costs, those kinds of things. I think this sort of spirit is around sort of state grants that people are used to, or federal grants. This is not a reimbursement grant. We are looking to provide the funds to the organizations. There is, of course, some expectation around spend down here on this. And so we will have some grant reporting periods in this that we need to know that things are advancing and that the funds are being spent down, but it's not a reimbursement model. So with the grant and grant agreement, there's some room here that it could be paid in 2 installments or maybe 1. We're working that out right now on the best model, but it's not a pure power reimbursement grant where you'd have to draw it down, and we're not doing a net 30, net 60, those kinds of things. There will be a grant agreement with it that may take a little bit of time to get all the signatures on, so that's a delay. But ultimately, we want to pay this to the nonprofit so that you can deliver the services as quickly as possible.
Okay, next question is, could grant funds be used on capital expenditures, namely a van for deliveries of food? And so if that is part of, I think Leif mentioned earlier that we could use that on some sort of parts of capital, and that would qualify for your program. And that's one of the items that you would need for delivery, or if you're doing food security, then absolutely.
Yeah. I think I will say that Jackie and I both know the more that's toward the program, the better. It's not a capital grant, but we understand that there's some needs that help advance the program further, and we'd consider that. If there's a collaborative, may use sub awards. We haven't gotten into subcontracting on this, to be honest with you. If there's partnerships that you have funds flow that works that way, the grant will go to one organization here. If there's some subbing out on that, there may be some stipulations in the grant agreement around that. That's not completely scrubbed and polished yet, but we'd be open to hearing what some of those sub awards might look like. But really, this grant is being given to a singular organization, and then what happens from there will have to be, it'd probably be subject to the grant agreement, to be honest, when we get to that point, should you be awarded. We will want to know that model if you're thinking about that in your application process. Maybe reflected in the budget to lots of ways to do that, but I'm pretty sure you're well versed in how that might look. If you have an additional question on that, though, with the email we give at the end, that's something you can resubmit that through that channel just to be sure.
Okay, next question. Are FQHCs not in your collaborative eligible to apply? Absolutely. If the FQHC that is applying is servicing the community in those zip codes, they are eligible to apply. So any community not-for-profit organization can apply as long as they're providing services in that community. Where do the funds for this award come from? Are they private or public? I believe they're private, right, Leif?
Yeah,
Private funds.
this is through philanthropic channels, and we're excited to be able to offer it. We've always had this ambition, and we finally have secured some funds to help build capacity here into the system. So yeah, through philanthropy. I guess it's me. Next question. Well played, Jackie. How many grants will you award this round? We think, okay, this is fluid here. It depends on, you heard some questions earlier. Do we need to apply for the full 125,000? Could we, for a smaller organization, could we apply for less? The answer is yes to that, right? So we think there will be somewhere between 4 and 6 grants awarded this period. It could be a few more, could be less. It kind of depends on what we're getting here. The total purse is, we're looking at this at the overall SSHCO investment here, but we think probably between 4 and 6 grants will be awarded this time. But it depends on what the size and scope are of things that come in. We're looking at all the proposals, scoring all the proposals through the method that we have, and then the board ultimately will make a decision here on what the final grants will be.
Okay, so the next question is, are there specific outcomes expected for the employment category? And so my answer to that would be that there are expected outcomes for each of the categories. So your work, the social determinant that you're going to be applying for. There are specific things that are industry standards and make quality applications. So I would really provide you guidance to follow that. So for all of the categories, I don't know if there's anything you would like to add to that, Leif. No.
No, I think that's spot on, Jackie. I mean, we are looking at, how we improve health here. So that's the ultimate goal. But yeah, that's well handled. There's another question here around the LOI process. If you submit an LOI, are you guaranteed to be invited for a full proposal? Or could we be turned down at that LOI phase? Thanks for that question. Really, at this LOI process, we're looking to get a sense of who might be applying for what, right? We understand that you may not have the full blown out proposal yet. You have an eye on what you think it will be. The LOI here is to get a sense of how many applications may come in. Obviously, you still have to get across the finish line, but all those that apply for the LOI or finish the LOI by the deadline will be asked for a proposal. Of course, then it's up to you to get that done by the next deadline, but we will be inviting all applicants for the LOI to apply.
If applying for emergency funding category, is there a certain percentage of funding that must go to monetary relief directly to the clients? Well, there is an expectation that the standards are followed for any kind of emergency funding. And so again, we have to go back to your proposal and see what you're proposing to do. And so some of that, when we review it, we would expect that you understand what you're going to be providing and what the norm would be. We wouldn't expect you to use 80% of it for internal activities. So just really follow the guidelines of the industry on that.
Yeah, I think it's fair to say you probably need to have some protocols in place already for that emergency funding. Jackie, I'm with you on that. And sure, that staff might be needed for that, but a bulk of that would be to help support under those emergency situations. How will we submit data to you monthly, quarterly? Right now, this is still subject to a little bit of a review on the timeline. So thank you for the question. Our practice across our institutions has been mostly quarterly, couple written, and definitely a site visit throughout the year. We think that'll probably hold sway here, and that'll be the model for reporting this time around. It could be that first report, I will say this, it could be that first report may be relatively quick in the timeline, just so that we know you're up and running with the grant. It may not be a full quarter on that first report. So I'll play that forward here, but quarterly has been the standard practice for us. Next question.
So I work for a youth center, and we're looking for support for a program that would provide youth, young adults, 18 to 24 with the food meal service. Is that an applicable program for this grant as it focuses on a smaller portion of our community? Well, we'd have to understand not just the scope of your services, but all of the outcomes and program description. I wouldn't discourage you from applying for it, but the reach would also be something to consider. So I can't say yes or no, we wouldn't consider something like this, but do think through your application.
Thanks, Jackie. These are great questions, by the way. Really digging into this and making sure folks know the spirit of this grant. So appreciate it. Are you required to partner with a health-based organization, or can community-based organizations apply? Absolutely, a community-based organization can apply here. I will say through the model, we may be fostering some connections to health centers here that are in the collaborative. That's the idea. So you'll see that kind of baked into the language in the RFP. But yeah, we are encouraging community-based organizations to apply here. That's a great question. Thank you.
Okay, the next question is a not-for-profit. Just to be clear, there are no funds to support outreach for this project through communication with community and in-depth interviews to highlight the work. I'm not sure what that question is really asking, but my interpretation is no. Do you understand that question, Leif?
I'm
We're
struggling
not
with
trying
it.
to do outreach just to
Yeah.
highlight the work that is being done.
Yeah, if I get, maybe you can add another clarifying question into the chat. My understanding is that seems like there's a little bit of a combination of marketing and outreach in that one. I would say if there are costs around engagement, outreach, or those kinds of things within your proposal that are necessary to engage the community, that's acceptable here. Because
And is it focused on the social determinants that we mentioned?
Yeah, I think that's fair play. We know that the personal touch in this work and that engagement and that connectivity is very important here. So I think it snaps to this, if I understand the question right. Maybe we leave that one out there to see if a clarifying question comes behind it. But if it's around engaging people around health and these social determinants, I think it's fair play. Maybe I think we're understanding that close, but if not, we'll move to the next question and maybe something can come behind. Is it me? Is it my turn?
It is your turn.
Okay, thank you, Jackie.
I know I drew you into my
I
conversation,
know,
but
we're all together. We're all in the mix. Next question, I'm working with about 5 community food pantries in the zip codes listed in the RFP. I help to support build capacity within their pantries. This sounds like a good fit for them, and I look forward to working with them during the RFP process. How can a food pantry be successful in developing this RFP? Most of the pantry's workers are volunteers. That is a very detailed question. I think we know this, right? The reason food insecurity, security are in this proposal is we know food and nutrition and those kinds of things around health, right, in households with patients is an important thing. If this grant is connecting folks to those resources, either through the partners, the health partners that we have, or the work that you're doing, that's a good proposal, right? We really want to see it. We can't obviously carry out the work. I can't spell that out particularly, but it seems like you have a pretty good roadmap here. If you can envision how that might connect to folks who are being served through this broader health collaborative, I think that would be great. Anything else on that one, Jackie? I think it's a great idea.
Mhm. Right. No, I
And
don't have anything.
can you connect what if you take it one step further? Can you connect folks who are coming through through the pantry? Do they need access to health services? That is part of this too,
Mhm.
and we might be able to foster those connections through this collaboration.
Yeah. Next question is there a minimum or maximum number of people we should serve with this grant? There is not a minimum or maximum, but you would want to be make us aware of the dollars that are spent on the participants. And so it should be in line with the amount that you're requesting. And so the services and how many people that impacts would be an important thing to make sure you consider in this grant.
Excellent. Is the renewal potential for time and additional money? I'll do my best with that one. I think you're asking, is this a possible renewal of this grant? This is a 1-year grant at this point. We are really trying to explore how these services might come into the Southside Healthy Community Organization model. We hope it will be renewed at least for a second year, maybe beyond. This is a 1-year grant, though, to answer that question. And assuming things go the way we think they might, there may be an option for future funding, and we certainly are going to work toward that.
Okay, for our next question, for employment, can it be used to fund the development of a workforce pipeline? And so from what I'm interpreting on this is you want to develop a workforce pipeline, and hopefully that pipeline will produce some different employment opportunity or people that will be able to work. And so really have to explain to us what you're going to be doing in the program to where we understand. And then if it's just developing a workforce pipeline that is not producing any new workers, say community health workers at the end, then that's a kind of a question. We would like to see what the product would be in that capacity, if I'm understanding the question correctly.
Yeah. Thanks, Jackie.
And it's about scope.
Yeah. I'm going to take a pause and do a process check here really quickly. We have 15 minutes left in this webinar. I'm going to point out a couple of things that may have been in the chat if the guest can see it. If not, I want to state it out loud that this webinar is being recorded. We will put it on the website, the Southside Healthy Community Organization website. And if there is something unanswered here, right, in this webinar, the email will be provided here, the info email that is in the RFP. Questions can be answered or sent to that address just in case. But we have 14 minutes left. I'll tackle the next question. Can church programs be considered? Yeah, I mean, I think so. We know the faith community is a strong partner here, nonprofit, of course, and that would be, yeah, there's a lot of great health ministries and other work going on out of faith-based institutions. So yes.
The next question is, can proposals be for projects or programs or general operating support? And so definitely for projects and programs. Now, what do you mean by general operating support? Let me just give you an example. So if Advocate Aurora decided to apply for this funding and want general operating support, no. If your general operating support is for a program or project that affects and is in those 4 categories for SDOH, then yes. Would you like to add anything to that, Leif? If I'm interpreting this right?
No, I think you're right on with that one, Jackie. Yeah. It's not exclusively a general operating grant, I think
Right.
is, yeah, where you punch that clearly. Next question has some detail to it, so I'm gonna summarize it a little bit here. Our organization has been providing emergency rent and utility assistance to individuals and families. They've done quite a bit of it over the years, which is great. There's some specificity in the Q&A section in case you're curious. They're hoping to be able to extend that support into the zip codes we noted. Would that be eligible for this grant? The answer is definitely, yeah. That's the kind of thing we know to support health improvement of the people we're working with, that sometimes that housing, that stability, that solving those problems is vital. Yeah, that's a great proposal. Please submit.
Mhm. Next question, you mentioned wanting best practices programming. Are you open to promising practices or an innovative pilot? Absolutely. We would welcome any innovation or promising practices that are based on best practice. Absolutely.
If you can back that play with any data or projections, we'd love to hear that. Next, Jennifer's funny. One last question for me. She said, thanks again. We have an urban farm that produces upwards of 16,400 pounds of food annually. That's impressive. I'd like to get, somebody's got a green thumb over there. And we donate a lot of the fresh produce directly to pantries and CBOs, community-based organizations. Would it be acceptable to use grant funds to reimburse Gary Comer Youth Center for the cost of the free produce we distribute to these organizations? If I understand it correctly, that's a intricate question, Jennifer. If it's the cost of supporting program to produce that, I think that's a fine purpose in the proposal. There's also, I happen to know this program, there's a lot of training and education and things that go into that around career and employment. I mean, I think there's a couple hooks on this initiative, and one worth putting forward. A reimbursement is a little tricky for me here. I think what we're really looking through these grants is to support that work that has that impact, that supports how many families, right, through that work. That probably might be the better model here. The reimbursement would be something that you might work out, in your own partnerships. But if you have a little bit of depth to that question, you want to email it, we'd be happy to respond through the email channels.
Okay, our next question is, can we connect people to health services we already have a partnership with? Yes, I'm thinking, I mean, I don't see an issue with that. So I just really make sure that we're addressing the social determinants of health in connection with those services, which is what this RFP is for.
Yeah.
Mhm.
Next question, I think, so that one's handled. Looks like 2 questions left, so we're right on time here. we have conducted interviews on these issues. I think the issues we've cited in the RFP here is what's being talked about with live call and promotional ads and community and working professionals engaged directly. We'd like to participate and allow partners to promote their work and help people locate and access resources. Again, this sounds like there may be some communications, marketing, or engagement work here, right? And this is sort of the second question of this nature. I say go for it, right? I mean, I think what we're trying to do here is, and Jackie jump in on this. I do think it's about, we know that closeness of relationship, that trust, that engagement is very important here. And those telling of stories is a very important piece of it. That sharing voices is a very important piece of that engagement. If the grant that you're putting forward is pure power marketing, I would say probably not. If it's engagement work and the mobilizing of people and telling the stories and connecting to the resources available, I would say yeah. It's not a marketing and communications grant proper. I think it is, though. We understand that there might be some sub items in a grant around that for engagement work or outreach work, as was asked earlier. So that's my best answer to that at this time. I think we'd have to see what's being proposed, but those would be my guideposts here on that.
Yeah, I would agree. Okay, final question here. Can we provide stipends to partner organizations through the grant? So stipend can be provided, and it sounds like they may even be subawards, but you have to have concrete, outcomes that you're thinking that particular stipend is going to affect. So wouldn't discourage it, but just be clear as to what that stipend is going to be used for, and then what the outcomes are from providing that stipend, for them receiving the stipend. So are they going to be doing a service for you, or how are they going to engage in the work in those 4 SDOH areas?
Looks
like we have
one more.
One more.
I like that. Sierra gets the last question here. Would a program around providing veteran employment and training be eligible for this grant? That's an excellent question. I don't see why not. I mean, I think when we look at employment, what that means around health, right? Health insurance, general well-being, right? We know employment is a big piece of the puzzle, especially in households. I think that would be a fine reason to raise your hand here. I would encourage it. And you can see, you've got a sense here that we're relatively broad in this with respect to the areas that we've cited, because we know there's some need around those four areas. Jackie, we got through some questions here. Always a pleasure to work with you on webinars or any other community aspects. So that's been great. I'll punch a couple things, and Jackie, make sure there's a last call in case I miss anything here.
Sure.
Okay? Going back to timeline, I'm going to punch this again. The LOI will be submitted online. Okay, it's an online form. That link is in the request for proposal itself, and that will be due by Monday, October 24th by 5 p.m. Central Standard Time. So wanted to be clear on that. Once that's in, you'll get an email saying we got your LOI, and then you're on track. If you got that email, you're on track to complete a full proposal. The next deadline is Thursday, November 10th for that full proposal, and that will be emailed in to info@southsidehealthycommunity.org. And along the way, should there be questions, you can also email questions to that email address. So these are 2 things we want to hold up here. in closing today. I do believe our team, as has pointed out, this is recorded. So if along the way, if you have a question, you can email it. If you want to go back and watch it, because Jackie and I were so engaging throughout this process that you want to see us again, you can go to the website and take a look. Jackie, I do see one more question came in there if you want to field it before we close.
Sure. Let's see. Do you have a specific date for the grant award announcement? And so, no, we don't have a specific date. As we had indicated before, once we do have the review of the grants, then we will have to get the approval of the board of the SSHCO. So we do not have a specific date at this time, even for that board meeting. And so as we get that date, we will let everyone know who wants to have that information.
Yeah, our hope is December, of
December.
course, but that's the expectation. One more came in here. We're maximizing these last 4 minutes. I appreciate it. That's why we're online. We submitted an LOI and haven't received an email. Should we submit again?
No, I'll send those emails out today.
Yeah, well, I think what we've just committed to, you heard from Jitan there from the ethers. She just jumped out. I would say that what we'll do is on a rolling basis now, when your LOI is submitted before that deadline, that 5 p.m. on the 24th, you'll get an email confirmation.
Okay, I think that was our final question.
One more, Jackie. It's one more in there. Are you available for an interview to discuss your program? Send that request, please, to the email address, and we will source it out from there to be able to answer some of your questions. I wouldn't say we have unlimited capacity to do one-on-one interviews with folks, but we might be able to answer some questions through the e-channel, electronic channel first. And if really there's some need for some additional technical assistance, we'll figure out a way to assign somebody to it. In the most part, I would recommend rewatching the webinar here, submitting your questions by email, and then if it's still unresolved, we'll figure out a way. But
and just to be fair to all the applicants, we wouldn't want to interview one applicant and not all the applicants. So I don't know that we have the capacity for interviews.
No, I mean, this would be a pretty special case. I think at this point, really submitting your questions to the email would be the best way to go. And we've been very responsive with that kind of activity, and happy to do that going forward here prior to the deadlines.
Okay.
Excellent. Well, Jackie, thank you. And team, thank you. It was great to have Kimberly here today too. On that note, please keep an eye out. We're going to be looking forward and tracking for the LOIs, and look forward to reading all of these exciting proposals. Appreciate the energy and participation here today. We're excited. We're excited to help build this model together. Look forward to hearing it from everyone soon. Thank you so much.
All right. Thank you.
Have a great day, everyone.
Bye-bye.
Bye.